happy to support the Residents of Distinction program here at Maui Derm. My name is Frank Kirchner. I lead the medical management team of North America at Beiersdorf. Now in its 15th year, we look forward to supporting this program into the future and look forward to the work that these future KOLs will have in advancing the space of dermatology.
I am Susan Miller, and I'm managing partner at Evince Communications. We have supported the Resident of Distinction program since the beginning in 2010 with our first group of residents. We are so excited that we've been able to partner with Maui Derm and the support of Beiersdorf to really advance the field of dermatology with new residents each year. And it's really fulfilling to see a lot of the residents from 10 and 15 years ago on the podium today. They are KOLs and they are teaching the newest generation of dermatologists.
Hi everyone, my name is Nagasai Adusumilli. I'm one of the graduating residents from GW Dermatology in DC. And I'm here at Maui Derm for the Residents of Distinction presentation. And my project was on topical roflumilast for mild HS. So I had the wonderful opportunity to discuss our results from our pilot study today. We have a lot of wonderful medications that have been approved for moderate and severe cases, so we wanted to look at to see if there's any options for mild cases. And spoiler alert, our pilot data does show that topical roflumilast 0.3% cream was a viable option in a small case series of 3 patients to clear nodule count and then help with the symptom severity as reported by patients as well. I'm looking for a career in academic dermatology, and I hope to pass along some of the mentorship that I received, both in my department at GW, but also for the Maui Derm meetings. I'm looking forward to attending future Maui Derm conferences.
Hi there, I'm Anna Catinis. I'm currently a resident at the Baylor College of Medicine in Houston, Texas, and I'm so excited to be here as a part of the Residents of Distinction program in beautiful Maui Derm. I just presented on one of our randomized controlled trials comparing 2 suture types, polyglycopene 25 and polyglactin 910, for high tension and frequently mobile anatomic sites. And just a teaser towards the ending, we're only at 3-month interim analysis, but it is looking like polyglycopene 25 is taking the cake for more narrower scars, but more to come once we finish up the study. I am really excited to start my Mohs fellowship at Baylor in the summer, and so hopefully I am a very happy and well-trained Mohs surgeon somewhere, intermixed with a little bit of cosmetics and gen derm as well.
Hi, my name is Chirag Vasavda. I'm a dermatology resident at Harvard. I'm really excited to be here over this week to be in Maui Derm. I'm really grateful to Beiersdorf for the opportunity to be here. I had the opportunity to present a lot of my thesis work over the past couple of years. I was an MD PhD student at Hopkins where I worked a lot on itch and pain. It's kind of what drove me to become a dermatologist, to try to help people figure out how to take care of themselves, to feel better in their own skin. So what I discovered was that patients with liver disease, they get really, really itchy and they get really yellow, and that's because of this molecule that's in their blood from their liver called bilirubin. We didn't used to have any good treatments for them, but what we were able to discover was that the bilirubin is actually causing their itch. And we were able to work with a pharmaceutical company, and we now have a molecule that was going through clinical trials that can help alleviate some of that itch, and hopefully one day we'll be able to provide some of that relief for patients. So currently I'm wrapping up my clinical training in dermatology, and I'm starting my postdoctoral work. I'm a little bit of a neuroscientist trying to figure out those treatments for itch and pain, but I'm also a chemist. So I've built this research program where I'm using organic chemistry to better understand molecular neuroscience. So hopefully down the line I'm going to have a clinic where I take care of patients with really bad itch or pain, and then running a lab where I'm trying to develop better treatments for those patients.
My name is Travis Dowdle. I'm a PGY3 dermatology resident at the University of Texas Medical Branch in Galveston, Texas. I'm really grateful to be here for the Resident of Distinction Award sponsored through Beiersdorf. It's been incredible to be here at Maui Dermatology on their behalf. I did a very interesting study looking at the relationship between anatomical site and the number of stages required in most micrographic surgery. And the key take-home point for my study was essentially, how can you optimize your schedule as a surgeon so that you put more complicated surgical sites in the best time period of your day, so that you can start with the most complicated cases and not be staying late. You don't have to spend extra amount of money on staff or electricity bills with your practice still being open, which I think is a very important thing. And hopefully this type of optimization would also kind of bleed over into other aspects of dermatology too. For myself, I see myself the next 10 years being a full-time Mohs micrographic surgeon in a private practice capacity, probably back in the West where I grew up originally.
Hi, my name is Shannon Wally-Wilson, and I'm in the dermatology residency program at UCLA in the research track in my last year of residency. I'm so honored to be here at Maui Derm as part of the Residents of Distinction program sponsored by Beiersdorf, and I will be presenting on a research project on wearable optical sensing for inflammatory dermatoses. The model disease that I'll be presenting on is for allergic contact dermatitis, but I'm excited that this wearable sensor we're developing is broadly applicable to other inflammatory skin diseases as well. For the initial application, we're studying it for the purpose of patch testing, but it is more broadly applicable to other inflammatory skin diseases for diagnosis and monitoring, and eventually we hope to study it for personalized treatment options as well. And for my future career goals, I hope to be a physician scientist running my own laboratory and stay in academics as a physician scientist, specifically specializing in device development and AI for dermatology.